Know about fear.
Fear is an unpleasant emotion that can result in nausea, sweating, even palpitations. Yet bizarrely, we seek it out. That was brilliant. But what is it that attracts us to things like roller coasters, bungee jumps, or scary movies? Okay, stop. There is no doubt that we like to scare ourselves. In fact, the 10 most profitable films in the last 5 years have all been horror movies.
Getting scared at the movies is one thing, but for some people, fear is something that they live with every single day. What can be absolutely normal for one person can be a real phobia for another.
Fears. Dogs. Well, like Alsatians and things like that. Got bit by one, so.
What age were you when you got bitten?
It's actually recently enough. It's only like October.
Oh, God. And
Yeah.
since then, you have a fear of dogs?
Alsatians more than anything.
I would tend, yes, to be somewhat claustrophobic.
The usual old flying business.
I don't like birds.
Mice.
Balloons.
You're afraid of balloons?
Balloons. I just hate the thoughts of a balloon coming near me and bursting into my face.
You're
Frogs.
afraid of frogs? Why
Frogs.
are you afraid of frogs?
Yeah.
I'd even have nightmares if they're on the telly.
When you live in a tough neighborhood, well, that could be enough, yeah.
That could be enough.
Yes, flying.
And why are you afraid of flying?
I actually don't know, but I did a Fly Fearless course, and I also went into a simulator to try and do it, to try it out and that. So.
Did it help?
Yes.
Okay.
Yeah.
So you
Mind over.
Excellent. So you overcame your fears?
Yes, I did, and I went to see my son. My son went to Australia, so I went to see him.
Oh, well done.
Yeah.
It's interesting that nobody mentioned spiders there. Arachnophobia is one of the oldest and most common phobias. Perhaps unsurprisingly, a fear of spiders is more common in women than in men. And unfortunately, that includes me. I've been bitten by spiders a few times and I have really bad allergic reactions to them, so I don't like being around spiders. Now, we're meant to go and film in this shop today, but I can't actually bring myself to pass the threshold. So maybe it's time I went and found out more about my fear. I'm here at Maynooth University to find out a little more about how rational or irrational my own phobia is.
A phobia is really a quite severe fear to the extent that it completely, and this is important, it completely debilitates the person from functioning in everyday life. So, for example, if you had a fear of driving, it wouldn't be sufficient to say that it was a phobia because you really don't enjoy it, or maybe you occasionally would prefer not to drive in the dark. It becomes a phobia when you can no longer go to work, you're so distressed, maybe you're not sleeping, you're willing to give up your job to not have to drive.
Is there a difference then between having an irrational fear and a rational fear?
By definition, all fears are rational, completely rational. What makes them look irrational is that neither the therapist nor the client, if they're in therapy, can remember the pathway from the beginning of the fear to where it's now emerged. And we call that generalization. Whereas you can't say that a fear is irrational just because it looks ridiculous to the person observing. To the person who has the fear, it's completely rational.
But is it possible to find out just how bad my fear is compared to other arachnophobes? To get things started, I'm going to take an EEG test. I'm sure this looks utterly ridiculous. My EEG test will tell me what's going on in my brain when I look at a series of images, some of them lovely and others simply terrifying. As the test was visual, it's understandable that the visual part of my brain was active. But was there any difference in my reaction when the spiders appeared?
Most of the interesting stuff happens in the first half a second after the stimulus pops up. And what you see is you've got slightly earlier and slightly bigger components in response to the spiders than you saw for the neutral stimuli. It seems to be associated with some processing over the back of the skull, so around about visual areas, which is predictable.
I think that is amazing to see that you can actually observe parts of the brain that were turned on when I saw the spider picture as opposed to when I saw the non-spider picture.
Yeah, and you can sort of see how the activation spreads from initially from visual areas to later on more frontal areas where you're starting to get into decision processes. So it gives you a very nice snapshot of the time course of what happens in the brain, the sequence of events.
So with this, I was just trying to avoid it.
It looks like you wanted to sort of get them out of the way as quickly as you could, maybe.
So the visual part of my brain reacted to the picture of the spider, and the thinking part even started to plan my escape. But what happens when I'm faced with the possibility of the real thing?
So here we've got a series of 8 jars, as you can see. What I'm going to do is gradually ask you if you're willing to put your hand in one of these jars for around about the 30 seconds and then take your hand out.
Okay.
Now, all I want you to do, as with any behavioural task, is to do what you feel comfortable with. I'm not going to push you to go further. I know you're quite competitive, but you don't need to go any further than you're comfortable with.
Right. I don't know whether I can trust you or not. Can I ask you, are there any spiders in here?
As you can see on the jar labels, you need to go by that. This is about taking a risk. You could think of it a bit like putting your hand in a cupboard at home and you're not sure there's a spider in there or not.
Working out the odds in my head, I'm prepared to put my hand in the first set of jars.
Okay, so 30 seconds
When it gets to a 40% chance of meeting a spider, however, I'm not so sure. You know, it's a pretty high chance. So it's like going into the shed or something like that. And I would generally avoid going into the shed. Okay. Okay, there's no spiders in there. This is awful. I actually feel anxious now.
Okay, that's your 30 seconds.
I don't like how I feel at the minute now because I'm getting, I'm getting prickly, which I don't like.
Okay.
Yeah. Now I've gone into panic stage, where at the beginning I was just like, this is fine, this is an entirely empty box, all of them are empty, because Andy wouldn't do this to me. But now, the closer we're getting to this, I'm like, maybe there is a spider in here.
Right.
And maybe if I put my hand in,
I'll
touch a spider, and I don't want to do that.
Okay, so how would you feel about the next jar?
I don't know now. I hate this because I'm a rational person, and this is irrational. Now I'm being irrational, so it's more likely than any of the other jars that there is a spider in here. Okay. It's going to do it really quickly. Okay, it's fine.
Oh, no. You can give me a chance to do my time.
Sorry.
You okay?
Now that I'm here, it's fine. I mean, there isn't a spider in here that I can... No, there's no spiders in there.
Okay. Time's up.
Okay, I did it. Now, not doing the others because it's a 100% chance.
Okay.
I'm proud of myself in that I did it, but I don't think it's going to change how I engage with spiders at home or anything like that.
No, I think you would need some additional work to get you to that stage.
So having established that I don't like looking at spiders, let alone putting my hand inside jars that may contain them, what do the test results tell me about my level of fear?
It looks like you have definitely got a fear of spiders, but it's completely within the normal range. Not only is it within the normal range, that is, it's not really even subclinical by the looks of it, but it's also contained very well because it only seems to apply to spiders and it only seems to apply to approaching them. So it hasn't generalized, as far as we can see, to all other insects, for example, which is where it starts to become a problem. So what you must not do is avoid the fear. It makes so much sense if you're afraid of spiders to avoid spiders, and it does deal with the problem. The paradox is it deals with it so effectively that it becomes, you could almost call that an addiction. The relief that people feel when they start to stay away from spiders is so great that they start to seek that feeling itself.
Brian suggested that I shouldn't avoid my fear, I should try and face it. So I'm back at the reptile shop.
Hi, Evie.
Hi.
Don't know how you're feeling. Are you okay?
Yeah, no,
Okay.
I'm just not going to go.
Yeah, no, that's absolutely fair enough.
So she knows that you are definitely a bigger threat to her. She knows that. No, you don't believe me.
No. She's lovely. I'm really glad that you like her. But I just have this terrible image that is going to jump at me.
No. First of all, it's physically impossible for her to go from this position onto you.
Okay.
Like this.
I can hear others.
We're all behind you. I mean, if you did want to even half try it by literally putting your hand out, and if she touched you and then you went, do you know what? No, this is horrible.
I feel like I should, but I don't want to.
If you want, once I get her onto my right hand, is that I would take my left hand and you place your hand on top of mine. No.
Do you know what?
Okay.
I don't.
Well, do you know what?
Thank
Look,
you.
we'll do a little
Sorry.
walkthrough of it, and literally, imagine your hand was on that, and then she would literally walk through it, and then. Sorry, that was me moving my hand.
Okay.
Sorry.
Well, folks, I tried. I really did. I'm glad I tested the boundaries, and maybe next time I'll actually hold one. Maybe.
Unlike Evie, I'm not afraid of spiders or heights or things that go bump in the night. But how do we acquire fear? It's my turn to take a trip into the fear lab.
So what we're going to do is attach you to this device. It's called an electrical stimulator, and it's going to present an electrical pulse to your forearm. And at the same time that we're sending these pulses to your arm, we're going to show you some words on the screen, and you're going to learn very quickly which words are going to mean, oops, I'm going to get stimulated uncomfortably, and which ones I'm not. And we are going to be pretty confident that within 5 minutes we're going to start seeing some fear of those words emerging for you.
So you're going to make me afraid
I'm
of
going to make you afraid
actual
of
word.
something, and then we're going to test to see if it generalizes.
I'm kind of cynical of how this works, but if you say so.
The great thing about this procedure is that if it doesn't work, you must be either dead or you're a tree stump. It's not possible for you not to show the fear, because it's actually a basic human learning process. We're going to measure the fear with a polygraph, which is the main component we're going to use today is called skin conductance. There are lots of ways of measuring fear, your heart rate.
It's like a lie detector test.
It's the main component of a lie detector test.
Okay, well, bring it on. Give me the fear.
Okay.
Calm, relaxing thoughts. Fib. Okay. Okay, wasn't it? I don't like that word now all of a sudden. Ill. Is it going to come? Yes. So now I'm basically going, I don't want fib to come up.
Yep.
Nothing happened last time I had ill. So ill is a good word in my mind.
So now the phobia is being analogued already.
Okay.
You're already becoming hypervigilant to the word fib.
No, it did. Thank you, Mr. Fib.
Now we're finished with that phase, which is good.
This test has shown that I have developed, whether I like it or not, a fear of the word fib. But what happens when I'm given the chance to avoid the word fib? And can my fear develop further?
If you press that spacebar at any point, it will disable the stimulator here and no pulses will go to your arm.
Okay.
At any time that you want.
Fib. Okay, I don't want to be shocked. Thanks, Mr. Fib. So now I'm not going to get one. Okay, so now here's a new word, lie, which is very closely related to fib. And I didn't get a shock from it. The mechanism that this has happened, fib, no thank you, you use that then to help phobics to unravel how they acquire the fear in the first place.
Exactly, how it spreads through language or not. It's a process of a negative experience making something aversive because it predicts something negative, and then the fear transferring onto other stimuli that remind you or are related to that.
But when you have a fear of flying, you don't go down in a fireball every time you get on a plane. So how do you, like, it's just the perception
It's
that
verbal,
it might happen.
it's language. It's based that the words... Well, that's the end of the phase. And that was
Please
a
contact
fitting
the
end.
experimenter now.
Okay. You did something quite unusual, which is actually a very good thing. You seem to have shown no avoidance generalization. So you showed very rapid conditioning of fear to the word, wasn't it, fib? And ill was a safety word, as we call it. And then when we threw in the word lie, which is the generalization stimulus, you chose to check immediately. That's a really good sign. For someone who's prone to anxiety, the first thing they would do is avoid just in case. And that's actually what most people do, most normal people. In fact, probably about 90% of the population would have pressed the spacebar to avoid a potential painful stimulus. Okay. What happens with mental health problems is people don't let the experience teach them anymore. They make up rules and they let the rule guide their behaviour.
As we've seen, fear has the ability to paralyse you, but it can also alert you to danger. It's finding that balance between healthy and unhealthy fears that can really keep us safe from harm. Coming up in part 2, how one man's arachnophobia was given the chop, and Jonathan finds out if the science of torture adds up.
We all have our fears, but did you know that some phobias can be given the chop? Last year, a patient in the UK entered hospital for brain surgery. The man had developed seizures, and doctors removed a small part of his brain, the amygdala, which had been damaged by disease. The operation was a success. The seizures ended, but then things began to get a little weird. A week after the operation, the man realised that his long-held arachnophobia had disappeared. Instead, he now found spiders fascinating, especially in the palm of his hand. So what happened? In the brain, the amygdala plays a crucial role in how we respond to something we're afraid of. It receives sensory input, like when we see a spider, and sends us information to other parts of the brain, which triggers a response like fight or flight. When it comes to a phobia, like arachnophobia, activity in the amygdala peaks. In the case of this patient, doctors believe that removal of part of his amygdala not only brought an end to his seizures, but to his arachnophobia too. Unfortunately, the amygdala is too deep in the brain for this to become a common treatment for phobias. So, were there any downsides? Bizarrely, the man became afraid of his pet hamster for 2 weeks and found listening to a particular jingle on the radio to be stomach churning. See you next time.
As Evie and Katrina have shown us, fear is a very real emotion that we all experience at some point in our lives. But what if it's used as a weapon? Is torture ever justified to help us find out what we really need to know? Jane, torture is something that we thought democracies had left behind. And then things like Abu Ghraib happened.
Yeah, democracies pretend to repudiate torture, but the reality is that despite them having signed the Convention Against Torture in 1984, many actually resort to the use of torture for reasons that are manifold. I think, unfortunately, it speaks to something deep and nasty within humanity, which is the desire to punish somebody else.
So when we're in fear, when we're being tortured, what's happening in our bodies?
Typically, if I was to air deprive you for a short period of time, you could do this yourself by voluntarily breath holding. What we'll see is a draining of blood away from the frontal lobes and other parts of the brain that are concerned with these higher cognitive functions. And blood flow will be concentrated in the brainstem where reflexes that are concerned with survival are concerned. These higher brain areas, for want of a better word, become shut down.
For most of us, torture is unacceptable from an ethical point of view. And yet agencies have been using it for decades. So a small part of me is wondering, is there any evidence to Shane's claims? Would my memory be affected in a stressful situation? Physiologist Onie Kelly has agreed to help me find out. Firstly, I'm asked to view some words and a complex drawing and try and commit them to memory. For obvious ethical reasons, I'm not actually going to be tortured, but Onie is going to put me into a stressful situation.
We're going to induce the diving reflex. So this is a very specific type of physiological stress. So it involves breath holding and cold stimulation of specific receptors in the face that induce this diving response. We need to increase blood pressure. We need to increase constriction of the blood vessels to the periphery, but we need to try to preserve oxygen. So in this particular response, in contrast to the fight or flight, the heart rate is lowered. Okay, so we just, you're connected. So Jonathan, whenever you're ready, just take a deep breath and hold it for as long as you possibly can, and I'll place the icy cold cloth over your face.
The combination of the ice cold water on my face and me holding my breath is enough of a physical stressor to induce the diving reflex.
Okay, so your baseline heart rate was above 60, and we're now seeing that dropping. And we can also see the climb in blood pressure. This is the classic diving response. Okay, that's brilliant, Jonathan. It's in minute 15. Just to let you know, the world breath holding record is 11 minutes and 35 seconds. Heart rate is plateaued now. That's great, keep going. Your blood pressure is climbing. And that's 2 minutes. We're over 2 minutes now. That's 2 minutes, 40 seconds. Okay. Okay. So immediately on recovery, we're seeing the heart rate coming right back up again and the blood pressure dropping down to a more normal level.
I wasn't sure if I could go longer. I felt that something would go wrong if I went longer. That's not pleasant. I didn't think it would be that bad.
Okay. This is a natural physiological response that is really all about survival and all about trying to protect the brain. But we've seen the physiological effect that it has on you. So now what we're going to do is to assess if it really did have an effect on your brain in terms of your learning and memory ability.
It's amazing how disorientated I felt after the test and how difficult it was to remember which words I'd seen earlier. No.
Violent.
Yeah, no.
Okay.
I feel I didn't do so well there.
You've basically got 5 incorrect responses here, which is worse on average than somebody who didn't have the stress induction.
Okay. And our second test was a visual one.
Second test is visual, so I'm going to give you 10 seconds to identify the one that you saw before.
Oh. Confidence training. They're all the same. What are you
3,
talking about?
2, 1. Go for it.
That one?
No, I'm afraid it was that one.
They're the same one, yeah.
No, they're not.
Oh, the line.
Just the one line there.
And as we've seen, I mean, what I went through, I was fully conscious of what was going on.
Yeah.
I could stop at any time.
Yeah.
You know, I was in a relatively safe environment.
Absolutely. If you're in a situation where you have extreme psychological stress right on top of that physiological stress, so feelings of panic or terror, hostile environment, we saw the effect of physiological stress on your accuracy of recall. To expect people who have undergone much worse stress than you just did to be able to recall information accurately, really, it just doesn't make any sense.
So Shane, if torture doesn't work, what does?
Well, what we're doing now works. We're talking to each other in a respectful, human fashion. What you really need to do is try and establish a relationship of trust with me. To do that quickly and rapidly, it shouldn't be a relationship of threat. You should be thinking about ways of building an affiliation between us.
So rather than bad cop, it's actually good cop we should be playing?
Absolutely, good cop. I think what we need to do is move away from the language of interrogation and move much more towards the language of kind of quasi-clinical interview. That requires that the individual who does these kinds of things is really, really well trained and has extreme quantities of self-control and is able to think not alone about controlling their own behaviour, they have to anticipate what questions to ask depending on the responses that the person that they're talking to is likely to give. It's a quite different way of approaching an interrogation.
Coming up after the break here on One, it's the main evening news.